So it's a real pleasure to be here to talk to you all about our work. The UK Health Alliance on Climate Change has been going for, I think, about 5 years now, but I only started very recently in the last month. So I'll be talking a lot about work that predates my time, but I'm honoured to share it with you. Yep, if we could have the next slide, please. So as the name says, we are based in the UK. And today I'll be talking about food, air quality and climate change in general. We represent more than 20 member organisations, including the Royal Colleges of Medicine, the Royal College of Nursing, the British Medical Association, various faculties, the British Medical Journal and the Lancet, and a number of other members. And we have grant funding and membership subscriptions, and our implementation continues. So if we could move, please. So the key steps so far, I mean, I had a long list of, I think it was about 10 things in the original case study, which I've given a very brief selection of them here. So we published our policy paper on air quality in 2018, which had some very detailed recommendations on air quality and public transport and active travel. We published a policy paper on food, climate and health, just very recently, actually, as part of the discussions around the National Food Strategy in the UK. In November 2020, we co-hosted the first day of the UNFCCC's Race to Zero dialogues with the WHO, the Global Climate and Health Alliance and other partners. We've enabled our members to develop health professionals' understanding through webinars that we've delivered jointly. And with the Global Action Plan, we've delivered a pilot project to educate paediatricians and respiratory health professionals to give advice on air pollution. Next slide, please. So the processes, I mean, we use a wide range of processes depending on the project, but we engage with decision makers, we campaign at key moments, we develop policy recommendations, we support health professional voices, we support our members, and we share our information. And I've just got some diagrams here on the left, our principles for a healthy recovery. There's 6 of them, and on the right, the results of a survey around diet. So 2/3 of UK health professionals agree that changing your diet in a way that reduces its environmental impact can also improve health. Next slide, please. We've made some good progress in this time. Several of our policies have been implemented either partially or in full. So for example, the ban on the sale of new petrol and diesel cars was brought forward from the 2040 date to 2030. This was one of our original recommendations. The call to action that we've developed for COP focuses the importance on 1.5 and offers several different strategies for achieving this. You can support that call and sign up for that call in the link in the slides and the case studies that will hopefully be shared. And when the UK was developing its new nationally determined contribution, we wrote to the Prime Minister calling for targets consistent with 1.5. The UK has set some of the most ambitious targets to date. We have a supporter list with over 1,300 members, and we collaborated with the London School of Hygiene and Tropical Medicine to devise and advocate the principles for a healthy and green recovery, which I shared on the previous slide. And these were published in the Telegraph and the BMJ. Next slide, please. So challenges and lessons learned. I mean, I focus mostly on lessons learned here, actually. So health professionals have an important role to play in framing the case for action to tackle climate change, and health is a strong driver of action. Health professionals have high levels of trust and credibility when advocating on issues such as air quality and food. Next slide, please. So the next steps, COP26, we have a lot of activity focused around that. I mentioned the call to action, which we're hoping will be signed by as many people as possible, especially health professionals, but we're also planning an editorial, which I'll tell you more about in the session this afternoon. We're going to do more work on air quality and food. We're supporting health sector decarbonisation. And as you may imagine from this very brief presentation, many, many more ambitions. Thank you for your time, and I look forward to more conversations today.